Hi, my name is Keith Swatz. I'm a assistant professor of medicine in the Department of General Internal Medicine and the Palliative Medicine program here at Mayo Clinic, Rochester. I'm here to talk about the findings in our manuscript entitled Palliative Care Consultation for Preparedness Planning in Patients Receiving Left Ventricular Assist Devices as Destination Therapy. This manuscript will appear in the June issue of 2011 of the Mayo Clinic Proceedings. This manuscript discusses our practice since 2009 at the Mayo Clinic in Rochester, Minnesota, of involving palliative care in the pre-implantation process for patients who are going to receive left ventricular assist devices. Previously, these devices were used for patients who might get transplants in the future, but as the availability of transplants has become, is something that's been very, very scarce. Many patients will not get to transplant. The indication for left ventricular assist devices as a destination therapy or as an end-stage option for patients who have advanced heart failure, the indications for this has been increasing. Since these patients who get these devices as destination therapy will eventually have a life-ending event, whether from the device or from something else, we felt it was important to discuss preemptively strategies for managing symptoms, quality of life, and goals of care in the pre-procedural period. At our institution, patients who have received left ventricular assist devices were seen by a comprehensive multidisciplinary team from the cardiothoracic surgery team, from cardiology, particularly the transplant, cardiology, and heart failure groups, social services, as well as other groups. We found it very important from previous work that's been done that providing good advanced care planning and having advanced directives that have details regarding patients' wishes for advanced measurement of these devices is something that's very important, and that's been work that's been studied with pacemakers as well as defibrillators. As the nuances of the care for patients with left ventricular assist devices are far more complex than patients who have received pacemakers or defibrillators, we felt it was important to have detailed strategies for managing some of the most common complications that are associated with left ventricular assist devices. We called the approach to managing these issues preparedness planning. And in the manuscript, we discuss 4 separate facets of preparedness planning. The first is dealing with common situations or complications that might be encountered in the setting of a left ventricular assist device. Sometimes this could be a serious stroke. This could be development of a comorbid condition because of the LVAD, such as renal failure or bleeding problems. So we really want to have an understanding of what patients' wishes are if the outcome from a complication is not what they had hoped for. The second situation we talk about is suboptimal quality of life. We hope that with patients that receive these devices that their quality of life is markedly improved. However, whether it's because of physical limitations or because of psychosocial stressors or other stressors that a patient might experience, their quality of life might not improve after these devices. As the devices improve, we hope that that number of folks who have suboptimal quality of life after receiving a device decreases. But there are people who sometimes do not have adequate quality of life, and we want to address that preemptively. The third situation that's sometimes encountered is what would a patient want to do if the device acutely fails? There are many safeguards with the left ventricular assist device that allow for the power and energy to be to provide adequate warning to patients to make sure they're aware that it's functioning. And they do regularly transmit information to the LVAD team to make sure that the device is working properly. But whether there's a reason for pump failure or a pump thrombosis that can happen, there may be an acute need for the pump to be switched out. When patients are local or close to the institution that implanted the device, that's less of a problem. But if patients live several hours away and only have medical centers that might not be familiar with the ever-increasing complexity of these devices, knowing how to manage that situation ahead of time is very important. The last aspect of what we do, I think, is most important for preparedness planning in patients who are receiving destination therapy, and that's helping patients to understand that this is indeed a device that they will more likely than not have until the end of their life. And though we might fix cardiovascular complications with this device, other comorbid conditions still can develop. We have had patients develop situations such as malignancy, other progressive diseases, other things that impact quality of life. Our previous work and the introductory work for this particular study has shown that even if patients have advanced directives and have cardiovascular devices, they very infrequently mention the device. So one aspect of our preparedness planning was to give much more detailed instructions to surrogates to help them to understand what the patient's wishes are in the event that their health outcomes are suboptimal, and how to manage the VAD if it's still working effectively at that time. In terms of future directions, we really see this as a very important first step in helping us to understand how to maintain and assert that patients have the best quality of life that they can after receiving a left ventricular assist device. We continue to have a strong interest in how palliative care can play a crucial role in asserting that symptoms are appropriately managed, that issues related to quality of life are fully addressed as frequently as necessary, and that discussions regarding goals of care and advanced care planning are had on a regular basis. It's with this that we hope to continue to find ways to mitigate stressful situations that might be encountered by our cardiovascular surgical colleagues, by patients, by their families, and others who deal with and care for patients with left ventricular assist devices as destination therapy. As the indications for placement of left ventricular assist devices increase, and as our technology gets better, we anticipate that patients will be receiving these devices with increasing frequency. While implantation is somewhat limited to tertiary care centers, we further anticipate that other centers on a more regional and community basis will likely have greater involvement with patients who have left ventricular assist devices in the near future. Since we anticipate that these devices will be placed with a greater frequency, we feel it's ever more important to discuss these issues preemptively with patients to make sure that they have a clear understanding of not only the potential benefits from a left ventricular assist device, but what some of the common risks and common difficulties that patients may encounter, and also to have an appropriate advanced directive or an appropriate advanced care plan that details what the patient's wishes are regarding management of the device in a variety of situations, whether that's in acute management of the device itself, or whether that's with other comorbid conditions that could arise.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.